Hello, my topic is osteoporosis and emtermeyer flash deformity. I studio University Catholic. My name is Diana Toala. Definition: there are a variety of problems related to the osteosis or hereditary multiple osteoporodromas. The majority of these problems relate to Butterson's bone protrusions with their effect on surrounding joints, muscles, tendons, nerves, blood vessels, and skin.
Okay guys, so today I'm going to talk about radiological findings of osteopetrosis. Here this is 2 minutes radiology. I'm going to only discuss about the important points or catching points in USMLE that can help you to diagnose it correctly. Let's talk about. Okay, remember in osteopetrosis there is generalized increase in the bone density. The bone density is increased. Okay, and you can see bone within bone, bone within bone appearance. Okay, just Google the images, guys. I cannot put the images over here because of the copyright, so just you can put the images. Okay, then very important is, as we discussed before, Erlenmeyer flask deformity. Okay, Erlenmeyer flask deformity of the femur. Right, and another one is Rugger Jersey spine, very important. Okay, and you can see spondylolisthesis. Okay guys, so thank you so much for watching this video. What are the causes for osteopetrosis? What are the radiological findings of osteopetrosis? The bone density, generalized bone density is raised, bone within a bone appearance, then Erlenmeyer flask deformity of the femur, Rugger-Jersey spine, and spondylolisthesis. Thank you so much for watching this video. Take care.
Application in nursing. The best way to treat this problem is soft surgical dislocation of the hip according to the technique of hand from Switzerland. This safeguards the circulation of the femur and avoiding a vascular necrosis of the femoral head.
Osteonecrosis is a disease caused by reduced blood flow to bones in the joints. In people with healthy bones, new bone is always replacing old bone. In osteonecrosis, the lack of blood causes the bone to break down faster than the body can make enough new bone. The bone starts to die and may break down. You can have osteonecrosis in one or several bones. It is most common in the upper leg. Other common sites are your upper arm and your knees, shoulders and ankles. The disease can affect men and women of any age, but it usually strikes in your 30s, 40s or 50s. At first, you might not have any symptoms. As the disease gets worse, you will probably have joint pain that becomes more severe. You may not be able to bend or move the affected joint very well. No one is sure what causes the disease. Risk factors include long-term steroid treatment, alcohol abuse, joint injuries, having certain diseases, including arthritis and cancer. Doctors use imaging tests and other tests to diagnose osteonecrosis. Treatments include medicines, using crutches, limiting activities that put weight on the affected joint, electrical stimulation and surgery.
Pros and cons. The osteochondromas can be restarted under direct vision and the femoral head templated with a special template to ascertain if the femoral head is spherical.
Only. Please consult your doctor before you make any decision about your medical care.
Conclusion. This deformity is usually related to extremity on locking of the soft tissues around the head can be distal, femoral, or promotional tibial osteoporosis. The treatment can involve resolution of the offending stosis and lengthening of the hamstring tendons if necessary.
Hi, I'm Dr. Courtney Sherman from Mayo Clinic in Jacksonville, Florida, and today we're going to discuss avascular necrosis of the hip, which is a hip disorder that we often see in patients that causes hip pain. There are multiple causes for avascular necrosis. They include idiopathic, which means it just happens and we don't know why. At times, oral steroids like prednisone can cause it. Sometimes alcohol can cause it. At times it runs in families, or there's other genetic or blood disorders that can cause it, such as sickle cell anemia. There are various treatments for it depending on the level that it is or the stage. There's 4 stages of avascular necrosis, 1 through 4, with 1 demonstrating minimal to no changes on X-ray, but we can often see it on MRI. And then stage 2 and 3 and 4 we can see on X-ray and confirm it on MRI. And as you go through that process of the staging, the disease gets worse and the hip can collapse at stage 4, which leads to a hip replacement. So ideally we like to see patients before they get to stage 4, because if you have collapse of your hip, then the only treatment really is a hip replacement, which can be very successful for patients if need be. So in avascular necrosis in stages 1 and 2, especially in that time stage 3, we have a new procedure that's minimally invasive in order to regenerate the bone, because in avascular necrosis the bone has deteriorated and partially died. Therefore, we're able to do this minimally invasive procedure where we harvest stem cells from their pelvis. We spin it down in a machine that extracts the stem cells in the operating room, and then we make a small 6 millimeter hole into the bone and then place the stem cells into the region of bone that has degenerated, with the goal of regenerating the bone in the region and avoiding a hip replacement for the patient. This procedure is relatively new in the United States. It's been done in Europe longer, and the studies have shown that then the next study is typically an MRI, and that will confirm the diagnosis. If this does demonstrate avascular necrosis, then it would be best to see an orthopedic surgeon at that point for further evaluation. For more information on this or other orthopedic conditions, please visit mayoclinic.org.
Thank you.